So unfortunately, even though this is supposed to be one of the most developed countries in the world, in many ways, we're not acting like it. This tweet that you're about to see broke my heart, and I'm sure it'll do the same for you, but assistant nursing manager at Mount Sinai West, I don't know how to pronounce that name, Cuse Kelly, in New York City has died from coronavirus. Nurses are having to wear trash bags as protection because there is not enough protective gear. So the nurse that passed away is on your left there, and then you can see there's a picture from the same hospital of many nurses wearing trash bags. They're doing this because we have a shortage of the protective gear. We don't have enough protective gear. We don't have enough masks. We don't have enough ventilators. We don't have enough ICU beds. We don't have enough of the antiviral drugs which help fight it. We don't have any of those things. So we didn't lock down early enough. We didn't quarantine early enough. A lot of states haven't quarantined at all yet. And also our hospitals are going to be overrun. And we're missing a lot of the basic equipment. In what's supposed to be the richest country in the world, they're wearing trash bags in a hospital which is one of the wealthiest hospitals, by the way. This is in Manhattan. If that doesn't tell you how the entire incentive structure of our health system isn't good, I don't know what will. If that doesn't prove that to you, I don't know what will. Aren't you embarrassed by this? I'm embarrassed by this. Aren't you embarrassed by this? I don't think it's that much to ask to lock down the country early on to make sure this doesn't spread. I don't think it's that much to ask to have a stash for pandemics of all the things that we need. I don't think that's that much to ask. I don't think it's that much to ask to make sure we have the protective equipment that we need. I don't think that's that much to ask at all. I think it's very simple. I think it's very straightforward. I think almost every aspect of the health industry should be nationalized because it's not an area where the profit motive makes sense. So we are uniquely unprepared for a pandemic compared to other countries. And we are on the trajectory right now to have the worst outbreak of everybody. You've been hearing how bad it is in Italy. You've been hearing how bad it is in Spain. You've been hearing how bad it is in China. We are on pace to have the worst outbreak in the world. Our trajectory is the worst outbreak in the world. And this is what your system looks like. I have a doctor friend in New York City. He also just tested positive for the disease. You want to know one of the reasons why? Because in China, when they deal with this, they're wearing hazmat suits. The doctors and nurses are wearing hazmat suits. Here, they're not even the people who have what's supposed to be the proper protective gear, it's not hazmat suits. So the protective gear isn't strong enough. This thing is more contagious than the flu. Way more, about double as contagious as the flu. So you should be dealing with it in the full protective gear. We don't have that here. We don't have it. Man, the system's so broken and we need to make so many changes. And not only are none of them being done, but also the president wants to order everything back to normal in 2 weeks before we even hit the peak of this pandemic, which could kill over 1 million people. It doesn't get any worse than this.